Good evening, everyone. Hope you're doing well. Thank you so much for joining us tonight. My name is Stacy, and before we begin, I just wanted to thank you all for coming and tell you a little bit about the American Board of Aesthetic Certification and Training. So we are an educational organization, and we focus on aesthetic medicine as well as regenerative medicine, which we're going to be talking about today. And a bit about us is that we have branches in the United States, Canada, and Asia. And together with our sister branches, we have been around for 10 years now, which is really exciting. And in the last 2 years, there has been a lot of expansion. So some of the exciting things I want to quickly share with you before we start is that we now have several in-person training locations across California, and we're branching out in other states as well. And as part of our growth, we're also working on partnerships with pharmaceutical companies across the US. So we want to help you be able to source things like peptides and things for IV therapy. So this is also something really exciting I wanted to share with you before we start. And now that you know all that, I would love to introduce Dr. Mohsen Talani. He is the director of American Board of Aesthetic Certification and Training, as well as the Canadian Board of Aesthetic Medicine. And for those of you who are our students, you might recognize him as one of the instructors. He has been teaching for many, many years, and I'm really excited that he's able to join us. So Dr. Mohsen, please come join us.
Yes, thank you, Stacy, for your introduction, but you didn't mention about the delay, did you? That I had. I mean, I have to mention about it, so that was my fault. So I see that the attendees are joining. I am so sorry for this delay. I know we're supposed to have the session at 6 p.m. The Pacific time. I had an accident, just very small minor accident, but we had to wait to figure out what to do. I am so sorry for that. So I'm hoping that it's worth your time that you came back, that we have an interesting session here. Again, I apologize for that, Stacy. I apologize to you as well for waiting for me. And we have to do this, redo the whole thing. So I tried to keep it short because I know some of you were planning for 6 p.m. Now we are starting with 1 hour delay. So Stacy, I need to be able to share my screen. You have to allow me to do that. There's a little arrow besides the share. If you just
You should be able to do
there
that
you
now.
go. Now I can do it. Okay, 1 second. Let me share my screen and then we start. Do you see my page? Do you see the slides, Stacy?
Yes, I can see your slides.
You can see it? Perfect, perfect. Okay. Hello, everyone, again. And again, I apologize for the delay and welcome to this session. Today, we are going to talk about very, very interesting topic, regenerative medicine in aesthetic practice. What is here today and what is coming next. I just wanted to mention, if you have questions, if you don't mind, just type it in the chat area, or if there is a Q, I don't see any Q&A. So there is chat area, and then at the end, we will go through all the questions. My goal today is to give you a better understanding, a practical view or overview of the regenerative medicine, this very rapidly growing field of medicine. We are going to discuss what treatments we have or what practitioners can do realistically today in this field, what technologies are not available, even though in terms of marketing in the market, we see that they are advertised very everywhere, but doesn't mean they're really available for us and we can do it in the US. What will become available in the next few years, and what business opportunities you might have if you start regenerative medicine if you have not yet. I will release a couple polls. I will, when we go forward, I think 3 or 4 polls. I would appreciate if you participate if you're interested in the questions that I will release. The other thing, let me see if I can access the polls. Let me see if I can see them here. Stacy, I don't see polls. I think you have to release them. For some reason, I don't see it. Okay, so you try if you can access them. When I tell you release, you can release them. Okay, there you go. Okay, you can. No, not this one right now. We start from first one. Okay, after, not right now. Okay, so we know that before I start, I just need to mention something that I want to define a bigger picture here. Regenerative medicine is a very broad field. It can include cellular therapies. It can include tissue engineering, biological products, blood-derived treatments, technologies that support tissue repair for the whole body. Could be for anyone, not just the aesthetic medicine. But today I'm focusing on aesthetic medicine. When I say aesthetic medicine, I mean that the treatments which are related to skin quality, rejuvenation of the skin, hair restoration, scar improvement, collagen stimulation, and recovery after the treatments that we have currently. Let's say you do filler, you do laser, you do microneedling, and you want to do recovery after that. So these are the popular areas that usually regenerative medicines are going to be used. So these are the things we are focusing on. Let me see if I can go next. Does it go next? Yes. There is a shift in aesthetic medicine. Meaning what? Meaning that for many years, the main conversations we had in aesthetic medicine and the patients were asking was about correcting the problems. The patient had lines. They were asking us to soften the line or remove the line. The patient had volume loss, and they were asking us to replace the volume. The patient had movements that they didn't want. They asked to reduce the muscle activity. I'm not saying these treatments are over. We don't use them anymore. Botox, filler, neurotoxin, filler, energy-based devices. They are not disappearing from the market. They're still there, but now, since we see this trend, we see this shift, sorry about that, the patients are asking a different type of questions, which they never asked 10 years ago. Maybe they were thinking about it, but because it wasn't available, they never asked us these questions. They don't ask, now they ask, how can I improve the quality of my skin? How can I look healthier without these over treatments that you used to do? Over treatment with the filler or even Botox. How can I stimulate my own collagen? This is something that the terminology 10 years ago, patients, they never said that, but now they use this terminology because they know the collagen after 30-year-old, every year, certain percentage are going to be lost in the body. So they say, can I stimulate my own collagen? They hear and they ask about these type of questions. How can I slow down my aging? Down deep and also superficially visible. How can I have a better hair? How can I rejuvenate my hair or restore my hair? So we see these shift in the trend in the market. So instead of they want to correct just the visible features of their bodies, different features that they used to ask. Now they want to have the improvement of the overall health, overall function, the quality of the tissue. They want to have a natural looking result. They want to have less downtime. They want to have faster recovery. They want to have long-term maintenance. And they're ready to pay for it because now they understand that it's not like before. I go do a couple of treatments, become more beautiful, and then that's it. But they know the aging process is a very long-term process, and they want to have this type of treatments. What is regenerative aesthetic? It means regenerative medicine in aesthetic medicine. Regenerative aesthetics focuses on supporting or stimulating the body's natural repair and renewal processes. So instead of we just put some or place some materials into the tissue to have some immediate changes or immediate results, now we're trying to encourage the body to have its own biological response, its own repair system to be stimulated and start working for us. So we used to do just painting the wall, for example. Now we want to repair the base or structure of the wall. So traditional corrections, they focused on visible surface only, but now in the regenerative aesthetics, we don't focus on the superficial. We go down deep, and then we're trying to fix the root of the problem. I don't know if I can. I wanted to release one poll here and see that. I see already a couple of questions here. I don't know how do I do that. I mean, Stacy, do you know how to release polls? I used to do that. I had another assistant used to do this for me, but I don't know how to do it. So
Which
then
poll would
forget
you
it.
like to?
I just wanted to release the polls, like the first one. I just wanted to know the attendees, how many of them are already practicing aesthetic medicine, how many of them are getting into, regenerative medicine, how many of them are getting into this? That was the question, first question. But if you cannot release it, that's fine. We can pass. Can you just look at it as a host if you can make a change here or just release this for me? Why the regenerative medicine market is growing? There are many reasons. Main reason goes back that there is a patient demand. Patients want this type of treatments because, as I said, they want more natural results. They want less downtime. They want slow improvement. They don't want immediate results. They don't want just suddenly they just make a change. There you go. We have this poll. Thank you so much, Stacy. How involved are you currently in aesthetic medicine? You choose one of them. I'm already practicing aesthetic medicine. I have completed training, but have not started practice. It's nice to have an idea that all the attendees here, what are their status, if you don't mind. I'm currently exploring aesthetic medicine. I'm already offering regenerative treatments. I'm mainly interested in adding regenerative treatments. If you just choose the answer, I would appreciate that. Yeah, you can release. Okay, nice. I'm already practicing medicine. Nice. More than half of the participants. So I've completed training, but have not started practicing. I'm currently exploring. I'm already off. So it's a kind of mixture of everyone here. Perfect. I'm gonna close it. Okay, I was just saying that why this market is growing, regenerative medicine market is growing. Combination treatments, because these days that this is attractive for patients and for practitioners because there are many treatments already available in the market. So you already do that. You have the patient's roster, so you can easily combine these treatments with your existing treatments. And long-term maintenance plan, as I said, the patients don't want immediate results anymore, and you don't want immediate. You just have one-time treatment for patients. So you want to have some sort of packages that provides many sessions for the patients, and that will have improvement in the whole aging process. So that's the main reason this market is growing. I would say mainly goes back to the patient demand. That's number one result of this. I want to try to go next. Is not going next. Many things is bothering me today. Oh my God. What is available today. So these are the treatments we already have in the market today. So there you go. So these are the treatments we already have today. So we have a PRP, PRF, microneedling. We have peptides, very popular, PDRN or polynucleotides. We have exosomes. We have stem cells that many of them not approved actually. These treatments are not all of them belonging to one category. Each of them have different pathway or different way they work in the body, but we call them all of them under the umbrella of regenerative medicine. PRP, I'm going to go through them one by one very quickly. PRP, PRF, they come from the patient's blood. So you derive the growth factors from the body and then you re-inject back to the same person. Microneedling, energy-based devices stimulate the healing process. Is a controlled damage of the skin. Biostimulators produce the collagen production. Peptides mostly are topical, injected now these days. We use them for many recovery purposes, weight loss, weight management, very popular these days. PDRN, they are not approved in US right now. They also use for tissue repair. Exosomes, stem cells, also not approved. I mean, exosome not approved in the US right now, and very popular, another very popular treatment, which I'm going to go through them one by one. Let's start with the PRP. Very quickly, I'm going to go through these treatments. And then I'm going to say, what do I think the next 2 to 3 years is going to happen, the future? I'm going to give you some examples of the ways that you can add these treatments to your practice. And at the end, I'm going to mention about how you can start if you have not done so to go to the regenerative medicine or add to your existing practice. PRP, as you know, PRP stands for platelet-rich plasma. It is prepared by using the patient's own blood. The blood is collected, processed, centrifuged, and then we take the platelets, separated the platelets, and re-inject back to the body to the destinations that we want. The hair follicles, the skin, sometimes tendons for the repair of the tendons, especially shoulder, very helpful, knee injuries. So these are the areas that we re-inject those platelets. We know the platelets, the main role is clotting, but they also release growth factors. So these are the proteins are processed are involved in healing process. PRP is, as I said, in many areas we use it. We can inject it with the needle, or very commonly we combine it with microneedling and we inject it with the microneedling. One of the main reasons PRP still is attractive is the source is autologous, means that it's your own body. It comes from the patient's body. But this doesn't mean that is necessarily safe. Depends, or also effective, because there are many factors involved here. Depends on the collection tube for the blood, depends on the centrifugation, the time of the centrifugation, the processing method, the concentration of the platelet. So if there are mixed with the blood cells, which would reduce the effects of the growth factors, the injection, the process of injection, how good it is, how deep it is, and then number of sessions, the patient selection, could be the patient's wrong patient. So many factors involved if the PRP is effective or is not effective. Many patients get a good result with PRP. To me, my experience, especially hair restoration, but many of them, they're not happy with the PRPs because there are many factors involved in the process of PRP. PRF, very similar. It stands for platelet-rich fibrin. It's the same, is prepared from the patient's blood, but the process, the the processing time and the tube is different. So the final structure becomes thicker, fibrin rich, and also they have a more gradual release of these growth factors. So they're intended to have a better effect, but not necessarily. Again, so many factors. The same factors involved in the PRP to have a good result, we have the same story here as well. Very common areas are used for PRF, they're famous for, is under the eye treatment. So we can say because of the skin quality of their, also hair restoration, PRF has a good result. One area that I see PRF is very useful and many practitioners use, the dentists. PRF is very popular in the dental area. The under the eye I was telling you, so is one of the areas that is promoted that PRF is very helpful these days, but it not necessarily works for every patient because we know under the eye is one of the trickiest areas for treatment because the darkness in this area, it could be because of so many reasons, because of the pigmentation, because of the, like a volume loss, because of the puffiness, could be fluid retention, could be because of the skin laxity. Not all of them are treated by PRF. PRF will increase the skin quality, but doesn't mean the under the eye darkness, the only problem is the skin. It could be many other reasons. So, but PRF is promoted for that as one of the biostimulators is another very popular, very trendy these days topic. So biostimulators, the main effect of biostimulators are they encourage your own body to produce more collagen. So as I said, that everyone knows, after the 30-year-old, some studies show after 25-year-old, the body's collagen is slowly getting less and less and less. So you don't produce the same amount of collagen you used to. So, but now what happens is that these can stimulate poly-L-lactic acid or calcium hydroxyapatite, technically the main ingredients, but these are the ones, but they're different brand names. We have a Sculptra, we have Radius, we have Rejuron. So we have different names in different countries or different regions. They are approved, but the same category. They are technically able to produce, stimulate your own body collagen to be reproduced and replace the volume loss in the area. But we need to understand one thing is this happens gradually. So this is a very gradual process. So because many patients look at the biostimulators as fillers or similar to fillers, what happens is these are not actually filler because you need to explain to the patient that biostimulators, they don't have that filling effect. The fillers, they fill the volume loss area and then you can see the result right away. But biostimulators, you can never see the result. You will see the results within a couple of months as the body gets stimulated and produces new collagen. And you see, there are some products internationally right now, they're getting approved that they are approved in some countries that they mix filler with biostimulators because the patient want to see the immediate result. So they see the filling effect result at the same time within a couple of months. Their own body gets stimulated and produce your own natural collagen. So the consultation is here important. That the way that you tell the patient, they need to understand that the results coming gradually. It's not immediate results. So they need to be patient. That's a little bit different than the old traditional filler treatment. So that's also biostimulator, goes under the same category of regenerative medicine, regenerative aesthetic. Microneedling, laser RF, okay, radio frequency. So another very popular area that we have and is very useful in the clinic. So we have technically these laser microneedling or radio frequency, they work, they create the controlled tissue damage. Technically, we damage the tissue we know after the damage of tissue, we have a healing process gets activated. So this healing will rejuvenate the area and will reproduce the new tissue. So that new tissue means rejuvenation, means reversing the aging process in that region. So that's very logical process. But the key point is the word controlled damage, because you can damage the body in any direction, but as long as it's not controlled, it's not something we want. It could be, has a more negative effect than positive. So that's why it's very important that this, with the proper device of laser machine, microneedling, pen, or the radio frequency heated actually damages we make here. So we trigger the healing process or remodeling in a controlled way. This treatment also very commonly can be combined with other treatments, especially microneedling. Microneedling can be combined with PRP. The clinic could have just microneedling. You just stimulate the skin. You just damage the skin controlled way, as I said, with the microneedling, the small needles that you damage the skin, and then you promote the healing process. Or you can combine it with exosome. You can combine or add PDRN, but I'm going to talk about the PDRN and exosome because they are not approved. I'm not promoting them directly, but I'm just saying that that's the way that can happen. So, or you can PRP, as I mentioned before. PRP commonly can be used with the microneedling. So these are the one you can do the combination therapy, or you can do alone. I think I would have probably another half an hour. Sorry if it's boring. I'll try to go a little bit faster. Growth factors and peptides. Peptides are gaining very much attention in the skin rejuvenation, also in the hair rejuvenation, in healing, weight management, as I just said that. So the recovery after the treatments we had, like a filler treatment, laser treatment, microneedling. So you use peptides for better healing. Technically, peptide is the short chain of amino acids, like protein, with the food that we eat, right? But we know that the peptides in the body, they do a lot of signaling jobs. The best example, probably the top list in the peptide is insulin. Insulin is a peptide, but the main job of that is to make some signaling activities in the body that has effects that we want, which is affecting on the liver and reducing the blood sugar level. So that's insulin. We have many other peptides in the body. So how about we just reproduce some of these peptides, connect these amino acid chains together, and then we reinject back to the body and promote these signals. So technically, whatever pathway we have in the body already doing some activities, such as what is happening to GLP-1 for the weight management these days, very popular these days. What we do, we stimulate the same pathway that makes you feel full and you don't eat anymore. We just stimulate the same thing. So you inject these peptides to the body, and the body thinks that the pathway is stimulated. So the emptying of the stomach is getting delayed. So the food stay longer in the stomach, so you don't eat anymore. Also, at the same time, has an effect on the brain. That brain sends the signals that I'm full, I don't want any more food. So these are the effects that we see. We are reproducing the same pathway in the body by peptides, by external peptides. But you need to know, when I say peptide, is a protein. It means that the body will look at it as another protein, like meat, right? So that's why that these peptides, many of them that are not available orally, that's why we inject them subcutaneously, because we want to bypass the stomach and intestine or duodenum. We don't want they get destroyed and don't get absorbed. So, but we have oral versions as well for the ones that for patients don't want to do the weekly injections. So they do the oral, but they have to do in a very specific way to make sure that the stomach doesn't destroy this peptide. But anyways, peptide is very popular. We have a very comprehensive course about peptide, talking about weight management, peptide in general. I'm making the course for sexual health and also the joint recovery. These are the two courses we don't have yet, but the next 2 months, my plan is to add these two as well. We have the weight management, we have the peptide in general. So then it's going to be added as well to the course. The next one is PDRN. PDRN also becoming very popular internationally. It's not approved in US as well. It's technically very useful in skin hydration, skin texture, treating fine line. Again, under eye rejuvenation, very important. PDRN is very useful. And also the generally tissue repair, anywhere you want to do the repair. They are very famous or maybe trendy under the name of the salmon DNA treatments or salmon sperm DNA treatment. Technically, what PDRN is doing is derived from some animals that we know or some particles of animals. But what they do, they can stimulate the DNA to send some signals for a body repair and also for the generation of new blood vessels. That's something we need for the tissue repair. So in the regions that we need to have more blood flow, so it stimulates the regeneration of the new blood vessels. And that is also something very popular, very helpful in the regenerative medicine. Stacy, I have a feeling that my voice or my image has some sort of delay. Is it good? Do you see me well, or any of the attendees, if you don't mind, just
It looks good on my end.
okay, perfect.
Yep.
If any of you cannot see, just let me know. Maybe I can. I don't know what I can do, but yeah, at least I know. So okay, exosome, another popular treatment. We know that it's very much discussed these days in the market. These are technically the small extracellular vesicles involved in communication between cells. So these are tiny biological delivery packages. They could be, they carry proteins, they carry lipids, RNA, mRNA, any signals one cell can send to another cell and send a message to them what to do, what not to do. Technically, that's what it is. So the exosomes can send a message to a cell and order the repair or faster repair or collagen production or whatever message we want to send to the cell. So from one cell, we send to another cell. So these are technically the messengers that we can somehow stimulate the body to do what we tell them to do, or cells what to tell them to do. So this is something very popular. Unfortunately, right now, there is no exosome approved in US. I'm not talking about the marketing, whatever in the market or online marketing, or you hear from the manufacturers. We don't have today, in July 2026, we don't have any approved exosome in the US. So you have to be very careful when you want to use this in your practice. Today, the goal is to just introduce and talk about it. It doesn't mean we are kind of approving that, oh, these are okay to use in the practice. You have to have your own due diligence and decide about here. There you go. That's the slide I had prepared. A very important slide, as I said, that a lot of companies are working on it to get approval of exosome and also PDRN, but at this point, we do not have approved exosome or PDRN in the US. So the question is that what is sorry, let me see it. Oh, here. Okay, what may be coming the next 2-3 years? Okay, that is looking forward. So these are the treatments that we have right now. I skipped some of the treatments. For example, IV nutrition has some levels of regeneration, and we actually have put it in ABACT. We have put it as a under the regenerative medicine package, if I'm not wrong, Stacy. We also have IV nutrition there as well. Has some effects of regenerative medicine, but has more broader effect. So there are some treatments I didn't mention, but a majority of the treatments that they are called regenerative medicine these days, I try to cover. What is happening the next 2-3 years? What are the treatment that becoming probably more available the next 2-3 years, or may become available? Because many of the researchers are happening right now. FDA, the manufacturers working very actively with FDA to get more, because very rapidly growing in this field internationally. So they're trying to do that, but at the same time, the clinical trials takes time. They have to be make sure that get the result that the FDA needs before they allow them to be used in the market. So if you see something that has some international approval and some initial researches they say, or trials they say that these are approved, or they may get approved, it doesn't mean they are approved until they finally get approved and then become available. What treatments I think become available? I put them together. So first of all, exosomes become more standardized, because one of the main issues of exosomes that is not approved or doesn't get approved is these extracellular vesicles. As I said, these are the messengers go from one cell to another cell. There is no way to make them standard. It can't just send any message from one cell to another cell because of the cell source. Could be sourced from the animals, could be from human. The concentration of them in each region, or in each extracellular vesicle, purity, manufacturing, storage, stability. So there are many different factors are involved that the regulatory bodies, they have an issue with making them standard. The standardization, I would say, if I say the word correctly, that is the main challenge is in the exosome and these vesicles for approval. I go a little bit quicker because this is mostly prediction, doesn't have any effect directly to your practice. The PDRN, very similar, as long as they can make it standardized, and then they can control the effects of this to the DNA stimulation. Probably we're going to have a good approval and many variety of these treatments in the market in the near future, maybe 2-3 years. Stem cell is another topic becoming very popular, and they talk about it probably the next 2-3 years as soon as become standardized. Stem cell secretomes. So they refer to technically the substances released by cells into the environment around them. So every cell releases some substances. These include the growth factors, cytokines, proteins, lipids, those similar to exosome, extracellular vesicles. So they believe every cell is like a factory, can produce so many substances, can affect the other cells around them. But these can affect the wound healing, can affect the skin repair, can affect the hair restoration. So these are technically the effects of these stem cells, but again is under the research right now. What are the negative effects of them if we just inject or introduce these stem cells to one area and allow them to produce these signals to the other cells to promote their healing? So it seems very nice, it seems very fancy and promising, but it doesn't mean necessarily is approved at this point, at least, but maybe the next 2-3 years. Hair restoration becoming very popular. I think that is very common because there is a huge demand for it. There is these days we have PRP, microneedling, exosome. These are the treatments we use these days. But I'm sure there are many areas of hair restorations. The next 2-3 years we hear becomes much more popular. Analogous treatments. It means that obviously that this is an area that a lot of people like it. As I said, it seems fancy and seems kind of safe because you feel that is your own body. Whatever you can derive from out of your body and re-inject it back to your body. The best example, PRP, PRF, we have it this day. But do we have other treatments? Can we do, let's say, something that is safe, effective, at the same time, properly can re-stimulate the own body? The idea of PRP, PRF, as I said, is we know that your body has growth factors inside the blood, right? But what we do with the centrifuge and taking those platelets, we concentrate them and we inject to one area, something that you have your own body, but you have it scattered everywhere. So we bring them together, we make them concentrated and inject to one point. This is the whole concept of PRP by PRF. So are we able to do the same thing for other treatments in the future? It's very, very a popular area of treatment that is under research as well these days. So we will see that very soon. You see these kind of treatments, maybe the next 3 years, 4 years as well. There is one tendency that I see that towards the creating the new areas of treatment towards the treatments combined with devices. Honestly, because these factories or these companies, they want to make sure that they produce a treatment which is cost effective. Many of the aesthetic practices, they already have many devices. They have microneedling, they have laser, they have RF microneedling. They have all these machines that they have already purchased. So their priority is, at least what I think is priority is treatments that are easier combined with the existing devices that they have. That's something that I think the market will go towards this. And I think this is the last slide about the future, which is AI. How AI is going to be used for the regenerative medicine. I don't know AI directly will do some treatment, but there are many areas we know that AI can do the helping the process in terms of tracking, in terms of making the standard images before and after, in terms of monitoring the hair changes and aging process, in terms of the tracking the patient outcome, and many other areas that is mostly information based. AI can help us to have a better data and better understanding in future treatment. So that's the area I think AI can be very helpful in the regenerative medicine. Okay, this is done. I talked about the treatments available today. I talked about what I think is going to be the next 2-3 years, 10 years, nobody knows, but I'm talking about the next 2-3 years. Let's talk about a little bit quickly about where the revenue comes from in the regenerative medicine. So first of all, the main procedure. You can, let's say, whatever treatment that you have, PRP, PRF, IV nutrition, whatever treatment you have, peptide, that's the main procedure. But you can also do the combine, like make packages of the same treatment or combine it with the other treatments, combine with laser. These are the very popular that you can do. The same treatment you do packages makes 10 sessions or every 2 months session, or whatever package you can do. And then that's you mix it. You mix it with the skincare or home care products. So these are different ways of actually making the stream of income in regenerative medicine. So example, microneedling. Microneedling alone. I said microneedling, excuse me. You can mix it with other treatments, but let's talk about just the microneedling alone. So the patient price is $300 to $450 based on which state and which area. Is it like a central city or suburban area? So the prices are $300 to $450. The treatment time of taking your time is about 45 minutes average. The costs are technically your time, your topical product, if you add some creams or HA products, creams, or I'm not talking about PRP, I'm just talking about just the microneedling itself. Disposables, the cartridge is your main expense, which is about $30, $40, depends on the machine that you have, and your own time, as I said. But you need to understand when it comes to calculation, we usually calculate this way. We say like, oh, I charged $300, I paid $30 to the cartridge. Oh, I have $270 profit. It's not calculated like that. You don't have 85% or 90% profit. The attendees who are already practicing in aesthetic medicine, which is about 60% of you guys in this list, you're already very familiar with this because at the end of the month, you have a lot of other expenses. You have rent, you have payrolls, you have insurance, you have marketing. If you have a staff, you pay to your staff. Equipment. That microneedling pen itself is about $3,000 to $4,000. So that's the one that you invested once. So that's something that you have. Taxes, also something very important. So how about you mix microneedling with PRP? Make it more fancy, better result, and better chance of increasing the profit. So now the treatment is $500 to $850. So you increase the amount that you charge the patient. Your expenses also increases because now you need the tube of the PRP as well. You need the blood drawing devices as well. So these are all expenses. So probably we talk about average $120, $130, sometimes cheaper, $80, $90, the tube for PRP and all the devices or consumables you need. And then again, cartridge of the pen, microneedling pen. So you need all this plus your time, maybe about 45 minutes to 1 hour time again. So then again, you have profit, but this profit is not the actual profit because you have so many other expenses. Let's not forget that. Okay, so this is a simple example. The package model is you don't give one treatment, you give multiple treatments. You try to tell them, okay, I cannot get the good result here. The best I give you 3 treatments, and then you charge them for 3 treatments, and they come and do it every 2 weeks or every time for future 3 sessions, 4 sessions. Obviously, that increases the patient commitment, and then you have a better predictable revenue. Another pattern you can do is a membership. So becoming very popular. There are so many apps help you to set up the membership and do the monthly, let's say, basic fee from them. And then that will allow them to have a certain discount for the treatment because now they are your member. But this means they're not going to go somewhere else. They're going to continue for their maintenance therapy back to you, and you reduce a cheaper fee. But at the same time, you make sure you have a longer term patients roster for your business. So these are different ways you can structure your pricing. I always say that if you have 5 patients per week, I say many of the students, if you put your goal to have 5 patients per week, this is not unrealistic number. So you charge them about $650. 5 patients per week is not too difficult for an aesthetic practice, which is based on regenerative medicine. I'm not talking about Botox and filler. I'm talking about pure regenerative medicine. But to be honest with you, you possibly need to do other treatments as well because many patients, they want more comprehensive treatments. And that would, the regenerative medicine treatments will give you more injectables. And injectable treatments will give you more referral for the regenerative medicine. So it's better to have all eventually, but not as a start. But if you do pure regenerative medicine, let's say the very realistic number of 650 average patients, 5 patients per week, we talk about 48 operating weeks. You talk about $156,000, the added stream of income. But this has to be obviously deducted everything from it. The rental, as I said, insurance, all the costs, your own cost. Don't forget, you doing the treatment. So you cannot say, oh, this is our profit because you have to calculate your per hour time that you're spending. I'm talking about this, you have a solo practice. I'm not even talking about if you hire a staff, then you have to directly pay them salary. But this one, you have to pay salary to yourself. So after calculating this, and then you can say this, how much is real profit of this business for you? There are startup expenses, obviously. There is training. There is the devices that you have to purchase. I just mentioned that the microneedling pen is $3,000. It's not cheap, okay? All the documents you need. consent forms and all the EMR that you need to have your patients. That's also $100, $200 per month you have to pay to set up all these things. The system for the pictures, photography. So you have to do that. You have to make sure that if you want to pay a lawyer for the legal review, supplies, consumables, and then insurance, marketing. Probably these days, one of the major expenses is marketing. 10%, 20% of your expenses goes to Google advertisement, social media, what do you call it, Instagram advertisement. And then if you have staff, you have to pay staff as well. And then taxes, obviously, another expense. To me, if you ask me if you have not done that, I don't know the attendees who are already practicing. I don't know what is their level of practice, how advanced they are, but I actually had another 3 or 4 polls. Because I was late, I feel guilty. I didn't release them. Already 7:50. So what happens is that start small and grow carefully. Choose one treatment category, if you ask me, one thing, just and then start based on that, working part-time besides your existing clinical role that whatever doing in hospital or somewhere else, and then complete the training. Make sure you know all the regulations related to that one treatment, and have all the documents, consent form, everything ready, and then make sure you have a good calculation of your costs and everything, and then start with some patients. You can rent a room in an existing clinic, you can work with an existing clinic, or you can get hired with a clinic that's probably they have to provide patients for you. I'm talking about if you want to work independently. That first example was towards that direction. So then make sure that expand gradually. That's one way of going forward. But some people, they want it more aggressively. They don't want to go this way. But I think this is the safest way because most healthcare practitioners, they have another job already. So they can add this gradually on the side and then slowly add and expand. What if you go too fast? What's going to happen? And what if you go too slow? Let's just look at both directions. If you move too fast, the cost would be that you buy inventory. Let's say you take a course with us tomorrow, and then you say like, you know what, I want to go aggressively. I want to do all the treatments because the way that we have structured our online courses are everything. We have a package that covers everything. You can learn PDRN, exosome. As I said, PDRN and exosome are not approved, but we have the courses for it because we teach internationally. We have these courses are covered. And then we have now many of our US students are learning these. It doesn't mean that they have to they apply it right away. They can wait to see what happens in the future, and then we go forward. So then I was saying that you can buy the inventory and then waste it because the inventory have expiry date. IV nutrition, for example, if you go aggressively and order a lot of vitamins and these cocktails, they have a very short expiry, some of them 3 months. So after 3 months, if you cannot use them, they are expired. You might not have a good experience and have a bad outcome for the patients. You know what I mean? And the patients start complaining. You might have a regulatory problems because you still don't know all the regulations and everything. Also, you might buy expensive equipments and you never use them. You know what I mean? That's another side of the story. So if you have a lot of patient complaints because you're going too fast, you might have a bad reputation and you don't even want to continue this field anymore. You say, you know what? I don't like it. I just made a Google page, and then now I have like 10 reviews, 3 of them are negative, so I don't even want to start this. So then you get disappointed and don't continue. How about you wait too long? Especially regenerative medicine because it's growing so fast. That also has a cost. So you have to somehow go somewhere between. Because you might have some patients that you do treatment for injectables or laser because you don't know regenerative medicine, they might go somewhere else. Patients now these days, if you don't offer regenerative medicine or peptide, they think that you're outdated. They think that you're not up to date. So that's something that you don't want your image to be like that. And then You cannot depend, not anymore. 2 years ago, 3 years ago, still depending on injectables alone, which is neurotoxin and filler alone, maybe PRP sometimes would be enough. It was really good stream of income. But these days, you cannot depend on only neurotoxin, and you need the skin treatment as well to add to these treatments. So, which is regenerative medicine. So you need to have a packages that cover all of this together. And also the learning curve becomes harder, which is true. And also that you might miss the future opportunities. For example, let's say you learn PDRN because you know the international, what's going on, you know? So especially we know because we teach everywhere. We teach to Gulf countries, we teach Canada, we have taught the last 10 years, the whole world, in Europe, Philippines, Indonesia, because those are the countries of Brazil. These are the countries more advanced. I would say not more advanced. There are probably easier regulations. So then they can have. We are kind of seeing the market, the trend, and FDA or Health Canada. If you are from Canada, it's just here. So they're more. I would say slower, but eventually they will get there. So if you start learning today, so you're ready as soon as the market is becoming available, the products become available, you're number one, you're one of the first people to offer the treatment. So the goal is not to rush. I'm so sorry, it's almost 8. The goal is to prepare. I like this sentence. So we have the regenerative medicine we have is fully online because we are assuming that most practitioners who join our program, they are already doing their practice. They know the basics of microneedling, even though we have a microneedling fully training with a lot of live demo videos and stuff to teach you how to do it. Or blood drowning, we assume you know, for PRP treatments and stuff. But what happens is that it's fully online. We don't have practical at the moment in the US. But we believe that online alone, it's really good enough. The courses are accredited, so for you to start practicing, as long as in terms of regulation and licensing in your state, you're allowed to do the procedures with the online training, unless they say we need or your state requires that you must have for certain regenerative medicine treatments the certain number of hours of practical hands-on, which we don't offer at this point. We do have practical courses for neurotoxin and filler. We have had that traditionally for years, but for these courses, we don't. So, but we believe our online courses is very comprehensive. We cover everything. Stacy, do you have by any chance share your screen with the list of courses that we have in that regenerative medicine diploma program? Very good. I love it. Thank you so much. So we have the regenerative medicine. I mean, Stacy is supposed to explain, but because I have involved in the teaching of many of these, I can quickly go through that. So we have one diploma program called the Regenerative Medicine, very reasonable pricing, but we cover everything all together. You don't need to purchase each of them separately. That is covering PRP. PRF is also ready to be added here. So we have PRP and PRF. We have one anti-aging course which covers all the anti-aging aspects: hormone replacement therapy, exosome, peptide, PDRN. Peptide is including the general recovery peptide and also the weight loss management. As I said, the sexual health and also the joint recovery, even though it's not a static medicine, but we are adding it to our peptide the next 2 months. So if you purchase these, you usually have access 1 year. So whatever we update, we just updating almost every month. You get access to them anyway. So you don't have to pay extra. So you do that. And then facial aging is another course we have that explains about the basics of aging. Can you go through the all-in-one slide? Because we have another very popular, perfect, I love this. We have another very popular online program. We call it all-in-one static bundle, which literally we cover everything online you need, right? Everything. Regenerative medicine, which I already told you, that has peptide, PRP, exosome, PDRN, hormone therapy, everything. And then I think you're supposed to write IV therapy here as well, Stacy. Is IV therapy is not in regenerative medicine added. We have the full IV therapy here as well. So IV therapy, which is another, if I'm not wrong, 10, 12-hour class course, that is included. And then we have injectables, which is all the Botox filler, everything. We have the skin diploma program, which is microneedling, chemical peel, laser, skin products, that you learn all the skin products categories and how you consult patients and everything. And then we have the facial anatomy, aging, and also cadaver. We have about, if I'm not wrong, we have had many congresses, mostly in Canada, internationally. We haven't had congresses in US or conferences in US yet, but they're all recorded and cadaver workshops of them already, which is almost probably hours, like 40, 50 hours of cadaver, if I'm not wrong. Cadaver workshops that if you're interested, they're all live, high quality, you can get access. All of them together is one price. You get access to all of them for 1 year and you get the certificate for all of them. If you are interested to this, any of this, you can contact the team and we go forward with that. I'm going to go through the questions. Stacy, do you see any questions here that you can ask me? If I don't see,
Um,
um,
I can see it here. I
oh,
can.
somebody complains that for us it's 10 here. I'm so sorry if it's 10. Maybe you are Eastern. Yeah, sorry about that. I hope you
So
forgive me. I hope it was worth it. You get a get general understanding of the field, and then we go from there. Ceci, any questions you see? Because I don't have access to Q&A.
yes, no problem. So we have many questions, but I'll just read the ones that I see repeated. So
Yeah.
there's several practitioners who say that they already offer Botox and fillers, and some offer microneedling as well. So they're wondering what regenerative treatment would be the most practical to add as a first treatment.
So they do, sorry, say it again. They do the injectables already, but they
Yeah,
want
so
to start the regenerative medicine. Which
yeah,
one
what
is?
would you recommend would be the most practical regenerative therapy for them to add
I would say
first?
depends on the state. I wish I knew the state of this attendee, but depends. But I would say peptide, especially weight management peptide, is very popular these days. I would definitely consider that. PRP, if they don't have PRP or PRF, very good. You can make very nice packages to attract many patients with this. I would go with the, if you want to know, and IV nutrition. So the ones that they are allowed, generally you can do it IV nutrition, uh, peptide with different aspects of peptide, and also PRP, PRF. Combine it with injectable, you have so many nice, but you need to have a good knowledge of skin dermatology, cosmetic dermatology treatments and stuff to offer skin products, good consultation, to have a good skin rejuvenation treatment for these for your patients as well. That would be a really good products, and you can make a good revolution in your current practice if it's only based on Botox and filler. You see anything else?
Yes. So thank you so much. Next question, we have several questions about exosomes. So people
Yeah,
are
I
saying that,
mentioned that the exosome is yeah. Go ahead. What is your question?
so apparently many people are seeing exosome products in the US. Doesn't mean that they're allowed to inject them. And what about using exosome serums topically after microneedling? Is that safe or legal?
Okay, so the product itself is not approved. In Canada, approved because we have many Canadian students as well, but US unfortunately is not approved. Or am I allowed to use it topically above the dermis level? Let's say microneedling, I set it up the setting that I only remain in epidermis level, right? Am I allowed to do that? I cannot encourage that. It's up to you based on your license, based on regulations in your state. But the product itself is not approved right now. That's all I can say. You know what I mean? I cannot endorse it, or I cannot say, oh, that's fine because it's a topical, you can do it. Um, I don't know what to say, to be honest, right? In terms of us, we have the courses, as I said, because we cover many international physicians and nurses as well. So we have the course available if you want to learn it. But how to apply it, to be honest, I leave it to you, and you make your own decision based on your own discretion of your practice. I don't know how, if it's a right way of answering. You're like, I don't know how to answer that, to be honest. Yeah. Okay.
Thank you so much for that answer. Okay,
Maybe we
then
go one more question. How many questions you have? Three? I see like three,
um,
but I cannot open it. Maybe go one more question.
we have quite a few, so let me just choose one of the questions here. Um, which regenerative therapy has the strongest financial potential? What can
Yeah,
make
very
the
tricky
most
question,
money?
but it's a good question because when you want to start, obviously you want to say like, but tricky, I mean in terms of that you don't know what to do, right? So it's like it's a very logical thing that comes to your mind. I would say the same answer, like probably peptides, because of, you know what, I would look at the feasibility of the treatment for my practice and adding to my current practice, comparing it to the popularity of the market. You know what I mean? Which one is more popular in the market? So I would go with peptide, IV nutrition. So then I would, if I can combine it with my current practice rather than I have a lot of investment for something that, I don't have it. So if I can combine, it's very individualized type of decision. But in general, I look at the popularity of the treatment in the market, which again, I go to peptide. These days, very, very popular. Definitely, you need to have peptide as a part of your treatment and IV nutrition.
Perfect. And I'm sure they have lower startup costs than some other therapies.
Yeah, but again, for IV nutrition, you have to be careful because of the expiry date of the products. It's not very expensive. The product's not too expensive, the vitamins and cocktails and stuff, but still you don't want to waste them because you have to make sure you have some patients available. Maybe start some market. Oh, I wanted to mention that we are making a course of a business development, which is, you're gone. Stacy, you're gone. Where did you go?
I'm
Oh, you're here.
here.
Okay. So we
I'm here.
have a course which is a 15 lessons. I'm making it myself with a couple of the colleagues focused on the business. So it's I think $350, but we are making it for free now. So anyone can get access, whoever are all of our students, and then the leads that they come to us and they are interested in our courses. Yes, the focus is like 15 lessons. Each of them is about 20, 30 minutes about business, pure business. The first five, it's mostly about mindset and if you have not started the static medicine, how to get into the field. Do I do it or not? Is it the right thing for me based on my personality? What type of business structure I have to do? So we are doing that. And then the next 10 sessions is about after you start. Like the your branding, your the online presence, your pricing, packages, everything. The stuff I touched like base today, like a little bit, but those are like a full course. I would definitely recommend that you release to the students or attendees of this session as well. They get access to that. It's free, and then they can also see that. There are some recommendations there over I make or my colleagues make about how to build the business. But I hope that that's helpful. I forgot what was the question. I just ended up to this. What was the question?
The question was about which treatment they should start with that would be the most profitable.
That's what technically I think I explained that. Any other question, or we can wrap it up?
I mean, we have lots more questions, but those were the most common ones that I saw.
Okay, no
So
problem. No problem. Thank you so much, Stacy, for hosting this session. We are planning to have more me or other teachers in American board to have more topics available. I think we're planning I think the second one we have now from this type. So we are planning every 2 weeks or every week we have one topic. Some of them are business side, some of them are like this, some of them are focused on treatment. I was one of the things we wanted to do some treatment live demo on patients and stuff. The goal is to do that. So if you follow us and then you see other webinars and you can participate, I'm sure we would be more than happy if we see you again in future sessions.
thank you so much. And we will be emailing everyone a recording of this webinar in case you want to review it and any updates about upcoming classes. Thank you
Thank you so
so
much.
much.
Appreciate
Hope
that.
to see you
Okay.
soon.
Yeah.
Bye.
Bye-bye. Bye. Bye.